my health sketch video, you will be learning the right techniques and the procedures how you need to follow the PPE and the safety infection control when you are handling the patient. So don't forget to watch till end to gain your knowledge.
During phlebotomy training, safety and infection control are the highest priorities. Every procedure must be performed with the standard precautions to protect both the healthcare worker and the patient. The first principle is to treat all blood and body fluids as potential infections. This means applying universal precautions at every step, regardless of the patient's history. Performing a proper hand hygiene is essential. Hands must be always washed before and after the procedures. Remember, gloves should be always worn when handling blood samples, and any cuts or open wounds must be properly covered to avoid exposure. Students are also reminded to avoid touching the face, eyes or mouth during the phlebotomy procedures, since this can lead to accidental contaminations. So always remember to perform a proper PPE hygiene while you perform the task. Safe handling of sharp objects is another essential key point. Needles or any other sharp should not be recapped, bent or broken by hand. Sharps must be discarded immediately into the designated sharp containers. So, in addition to these precautions, we follow OSHA guidelines during training and clinical practice. Waste disposal is also emphasized in phlebotomy practice. Proper segregation of waste ensures safety and compliance with infection control standards. Sharps must go into yellow containers, surgical and contaminated waste into the red bins, and general waste into the black bins. Color code systems prevents cross-contaminations and maintains a safe clinical environment. Another important area that we should cover during the session is the blood-borne pathogens. Students learn about viruses such as HIV, hepatitis B and hepatitis C, which can be transmitted through contamination, needles or contact with infected blood. OSHA requires the consistent use of personal protective equipments, which we call as PPE, including gloves, gowns, masks and protective eyewear when it's necessary. Each item of PPE serves a specific role in preventing and transmission of infections and ensuring safe patient care. During your practice, you also need to understand the modes of transmissions essential in order to prevent accidental exposure. So remember to take necessary prevention measures such as using PPE correctly, following hand hygiene and disposing the sharps or other waste properly to the designated bins. Once the concepts are explained to the students, they are also given an opportunity to apply their learning in hands-on demonstrations. They practice proper use of PPE, correct needle safety techniques, and step-by-step disposal of needles, needle caps, and barrels. Students are now opening the sterile needle packet carefully, making sure not to touch the needle tip to keep safe and clean. Before using any needle, it is important to check it properly. Always look at the packaging to make sure it is sealed and not damaged. Hold the needle by the hub and attach it securely to the holder. Always make sure it is tightly fixed before proceeding. These checks are the vital part of the patient safety and infection control in phlebotomy practice. Following these guidelines step by step will ensure a proper safety technique during the phlebotomy training. Now, the students are practicing how to properly check the needle before use. Each student carefully inspects the packaging, making sure it is sealed and undamaged. They also practice the proper disposal methods after use. The entire needle along with the holder is placed directly into the sharp containers, and other devices will go to the relevant designated containers as follows. They also demonstrate the correct method of removing gloves and perform hand sanitizations afterwards. This practical demonstration not only helps students to build confidence, but also ensures they are prepared to follow the safe practice when working with the healthcare professionals or real-time patients. By practicing under supervision, they gain both the knowledge and practical skill set needed for professional phlebotomy. We also have an encouraged moment for relaxation and fun time. Students come together to take a group photo, enjoy the session and celebrating the learning experience with us.
Alright. Thank you for watching my video, and if you find this video useful for phlebotomy training, don't forget to subscribe my channel and press the bell icon. Stay connected and see you on another health sketch.